Hello, and welcome to the Newbie Dentist Podcast, the safe place for newbie dentists to connect, collaborate, learn, and grow. The Newbie Dentist Podcast aims to provide high-quality and high-value content for all the newbie dentists out there. With your host, Dr. Omid Azami.
Hello, and welcome back for episode 14 of the Newbie Dentist Podcast. I'm your host, Dr. Omid Azami. I'm excited to be bringing you guys a two-part series with Dr. Bruce Freeman. Dr. Freeman is an orthodontist here in Toronto and works out of Mount Sinai Hospital, specializing in oro-facial pain and temporomandibular joint disorders. In this first episode, we talk about life outside of dentistry, managing burnout, side hustles, and many other topics, which I think you guys will really enjoy. Dr. Bruce Freeman is a very articulate and thoughtful speaker, so I really did enjoy this conversation with him. And in part 2 of this series, we will be talking about more clinical dentistry, talking about occlusion, night guards, orthodontics, and of course, oro-facial pain and TMD. So without further ado, we have Dr. Bruce Freeman. How are you doing today?
Very well. I'm very excited to do my first podcast.
Excellent. So if you want to just go into your background a little bit, obviously just to go over quickly, you went to U of T for dentistry, and then looks like you went over to the US for a residency AEGD.
Right.
And then you came back and did some ortho training. So if you want to just take us back to finishing up dental school and sort of what was your mindset, and sort of talk us through like what led you to ortho and then into the Masters of Science in TMD.
So when I graduated, not a lot of people did internships. It was sort of a new thing, and the main internships were hospital internships, and I applied to one of those, and one of my instructors had gone to the Eastman Dental Center in Rochester, and he said, "You have to go there." I said, "Okay." And you're young and impressionable, and there was no internet, so you couldn't check anything out.
Yeah.
So I said, "Okay, I'll apply." The salary was $10,000 and $10,500, and then you worked a couple days a week, so it was simulating private practice.
Yeah.
And it was a little tough, as people know. A lot of your people that are graduating, with match programs and everything, they're never in sync, and you're stressing out, and you're trying to guess and bet and see who's going to take you. So I called the hospital where I now work, and I spoke to somebody who said, we'd like to have you in the program. And I said, I'm just waiting, being naive, waiting to hear from another program. When can I let you know? And he said, I don't know. No one's ever asked me that question. So I thought, I've just, ruined my career before I left. And I decided I'm going to go away. Everybody, including my parents, thought I had lost my mind because, how could you go somewhere nobody's heard of?
Yeah.
And I did. And my classmate from dental school, her husband was doing his PhD in Rochester, where the Eastman Dental Center is, and we went.
Yeah.
Not knowing what we were doing. And it was the best experience of my life. I didn't know what I was doing, who anybody was, and I met people from all over the world that I am still friends with. I have a friend who's an orthodontist, and a phenomenal orthodontist, Christina Corvati. She's in Bologna, and I've known her for almost 30 years.
Nice, yeah.
I visit her, she visits here, we communicate, we show cases to each other, and it's great because you have an opportunity to learn from a million different people.
Yeah.
So I did that. Then I wanted to be an orthodontist, and again, no internet, so I just kind of applied to some schools, didn't know what I was doing. In fact, when I applied to dental school, I applied to one dental school because I really didn't know there were more.
Yeah.
So I'm not joking.
Yeah.
So then I applied to ortho, came back, and did my master's part-time while opening my first office, which was probably stupid at the time. And I decided to do it in facial pain and TMD. My first master's project kind of fell apart, and last minute I went looking for another supervisor and another project, and so I kind of fell backward into TMD and facial pain.
Yeah.
Again, not knowing what I was getting myself into. Yeah. And I now work at the hospital that I decided not to go to for my internship, and I now interview people for that internship that I didn't do.
Yeah.
So I tell people if they don't get it, don't worry, life goes on. And so I help manage facial pain patients, TMD. We educate the residents, the dental specialty residents, even some of the medical residents, facial pain fellows. So it's pretty amazing what you get to do. Some days are crazy because, we're ordering MRI, CTs, and sometimes you just have to take a step back and say, wait a minute, I'm just a dentist. But we have an amazing team of medical and dental specialists. So it's really the best care you can have because you have all the brains there. So, if you don't know something, there's somebody else that does.
Yeah. That's pretty cool. So obviously we sort of want to do a 2-part series, and the first part is going to be more about life outside of dentistry. One of the things I want to sort of start off and talk about is grad. The first few months can be pretty overwhelming. So every time you're at the office and you're doing something, you're kind of doing it for the first time, and everything's a big deal, and everything's like a dramatic sort of failure if it doesn't go well. So what you've been around for a while, and you've been doing this for a long time, and you've seen a lot of new grads coming into the residency program and sort of interacting with them that way. So what tips would you have for a dentist having a rough day coming home? And because I know a lot of people struggle with that initially. They come home and they're down on themselves, and then the confidence goes south, and then other issues start to come up that way.
I think you have to go back to dental school, because just like you train and learn how to do a crown and a bridge, you have to train and learn how to screw up. Yeah. And it's sad, but things happen.
Yeah.
And it's not about the fact that something happens, it's how you manage it.
Yeah.
And that's why you're in dental school, because when you're in dental school, every crown you cement goes on without a problem, every bridge you cement doesn't rock. Then you go into practice, and the first bridge you do is teeter-tottering back and forth. You're thinking, what do I do? Yeah. So you want things to go wrong in dental school, and you have to learn to really, it sounds sort of corny and yoga-like, but you have to learn to breathe through it, because you're going to get better. And the biggest problem right now is criticism, and you have to learn how to take criticism.
Yeah.
And criticism is a word that has a negative connotation. And to me, it shouldn't be called criticism. It should be called feedback. Now, there are many instructors who do not know how to give good feedback.
Yeah.
And they'll do it in front of the patient, or they'll be rude about it or something. But you always have to understand that there's a kernel of truth probably in what they're telling you.
Yeah.
And you have to take a step back and say, okay, look, I just want to do a good job. I want to do a great job. And the only way I'm going to be able to do that is if I really pay attention. And you have to take your ego out of the situation.
Yeah.
And there's a thing I think we may have discussed on the phone when we were chatting about setting this up, the Dunning-Kruger concept. Dunning, D-U-N-N-I-N-G, Kruger, I think it's K-R-U-G-E-R. This is a concept about self-awareness. And a lot of people do not have this.
Yeah.
So a lot of people will... say, I paint on the side, and they think they're fantastic, and their friends think they've lost their minds.
Yeah.
So you have to realize that
guy Jim Carrey.
Yeah, exactly. Or people do think they're funny and they're not.
Yeah.
But having self-awareness is tough because it hurts the ego.
Yeah.
So you have to sometimes take a look and say, you know what? Pedo's not my thing. Pedo's not my jam. I just can't handle a kid.
Yeah.
Sometimes you think you can, and you think you're doing great until someone comes along and says, by the way, you're not doing a good job.
Yeah.
So I think having this introspection and reflective kind of behavior and introspection helps you understand that, I'm not good at everything, and I'm going to get better. You don't go to the gym and grab a 100-pound, dumbbell 5 minutes after getting to the gym. You got to work your way up.
Yeah.
And it's the same thing. And learning how to handle a bad day starts in dental school, because a lot of people have grown up, unfortunately. Now, as you know, you come in 10th in the race, you get a ribbon.
I was going to mention that. Yeah.
There was a guy in the States, I think a couple of his kids got a "you showed up" ribbon for football. He made them go back and return it.
Yeah.
And there was something posted from a school in Arkansas. It was a private school. It says, if you are here with your child's gym clothes, project, or lunch, turn around. They will figure it out themselves.
Yeah.
Like you're not allowed in. And that needs to happen, because you know what? Disappointment occurs and things, you go to put that denture in. I still remember doing my first full upper denture. It was a partial lower, and we had this one old time instructor. Man, this guy he just fixed everything. Yeah. He just was so off the book. So he was the MacGyver denture. Yeah. It's funny, there's two guys we used to call that.
Yeah. And
one of them, he'd been practicing for 900 years, and I I went up to him and I said, I put my denture in. I put I swear I think it's moving. And he goes, is it screwed in? I went, well, no. He goes, well, then it's going to move. I said, okay, well, lesson number 1 for the day. I've learned that
Dentures move.
Dentures move, yeah. And I even had an instructor back when I was in dental school, you had to run out of the lecture hall and sign up for a chair. And I was the only one in a section with one of our restorative or operative instructors, as you call it. And he says, I don't understand. Everybody complains there's no chair time. Why are you the only person here? And I said, well, don't you know? And he said, no. I said, everybody's afraid of you.
Yeah.
And he said, what do you mean? I said, this is a guy who wore magnification back in the day before anybody did.
Yeah.
So he would have his glasses on, the magnifiers, a mask, and he would look at your impression and raise one eyebrow, and people would run out crying. All it took was to see this guy's eyebrow arch like 3 millimeters, and you were
in trouble.
Up. So he said, well, why are you here? I said, I just want to learn.
Yeah.
And I always had that attitude, and it was hard because it's hard to hear you're not doing a good job, or it's hard to realize maybe I'm not good at something.
Yeah.
And when I interview, I always ask the question, I said, what procedure do you not like or you not feel you're good at? And the candidate that says, no, I feel pretty comfortable at everything, and I think I do a good job in all aspects of dentistry, ain't getting in, because that's a red flag.
Yeah,
that you think you're great at everything. So it's really hard, and I think I saw pretty much my entire class at some point cry in dental school, and it's just the natural thing. Mm-hmm. We used to have a lab fellow, the guy who ran the lab. He'd walk into the cafeteria, it'd be noisy, people would talk. He'd have an articulator in his hand, and the place went dead silent. And everybody was just praying that he was not going to come up and talk to them. So, dentistry is hard, and people don't realize you're doing skills that you've never even done before. Yeah. And, maybe you told people when you were applying to dental school on your interview that you played the guitar, that you did, model planes, that you did all these things.
Hand skills, yeah.
Yeah, you have hand skills. But when the skill is attached to is attached to a human being, it's a whole different story. Because also people get upset, when they start drilling on plastic teeth in first year or second year, or they're doing simulation labs. The person next to them is, Picasso, and they are making a mess.
Yeah.
But it's interesting, some of those Picassos in first year fall apart in third and fourth year because they don't know how to handle the patient.
Yeah.
And so you have to have hard skills, which are your clinical skills, and soft skills. Mm-hmm. And the other thing is you have to realize when you graduate, that's when it really gets tough. And it's no joke. That's when you really start learning, because you have no idea what you're doing.
Yeah, for sure.
Some people graduate having done, only a handful of procedures. Some people graduate, there's schools in the States where you graduate having done 50 plus crowns, and some people graduate having done 4. Some people saw a bridge and never cut it.
Yeah.
So you're in practice, and now you're learning, okay, my clinical skills are sort of not that great, and I don't even know how to talk to a patient.
Yeah.
So it's about watching. It's about listening to your podcast. It's about watching the principal dentist. And sometimes people say, oh, I'm in this office and it's the worst office. I say, great. And they say, why? I said, you'll learn more sometimes from working in a bad office than working in a good office. Sure. Because sometimes every procedure, every patient, the more you do something, the more you sometimes can forget there's, those teeth are in somebody's head. And then you see dentists chatting with their assistant over the patient like they're not even there, not even a tap on the shoulder. How you doing?
Yeah.
And people don't realize it's all about communication, and it's all about being heard. And misery loves company, but by talking to other dentists and having a group of people that you converse with and bounce ideas off with, that helps decrease your stress. I mean, I've been an orthodontist for longer than you've been alive, and I have a group, and we share cases constantly. We talk literally every day. We text, we call, we send articles to each other, and that's the only way you're going to learn. And then sometimes you realize, you know what? Everybody has troubles, everybody struggles, everybody's stressed. Mm-hmm. And, my friend in Italy will sometimes write about a case, and, I know it's a problem when in the subject line it says, Mamma Mia, she's got a tough case on her hands. And she says, I don't know what to do, and she's probably one of the most phenomenal orthodontists I've ever met in my life.
That's awesome.
So there's always about that. But part of it is you've never really worked 8 hours a day, 5 days, 6 days. I know you work, 49 hours a day, 700 days a week. So First thing I would always tell people is when you get out into practice, you need to schedule a mental health day.
Yeah.
So let's say like you who works, 9 days a week, you have to schedule every 6 weeks a half a day or a day out of the office, and you plan something with your friends or your wife or boyfriend, girlfriend, whatever, and you look forward to that.
Yeah.
And it has to be non-dental. And sometimes you'll maybe even a course where you go with a friend and your course is just out of town. You have go out of town, you go for dinners, you have a good time, you meet new people, you talk about things. You also realize you're not alone and everybody's struggling the same way.
Yeah.
The other thing is also, one thing I always tell people is yoga, and more yoga.
Yeah.
I'm not talking, jock yoga or crazy sometimes, Cirque du Soleil yoga. I'm talking yin yoga, hatha yoga, because your back is your life.
I feel it already. I'm barely a year in, and I'm like,
and you're lopsided. No, you're not. But
no, I am.
When you
good observation.
When you go for a massage and the massage therapist says, well, that's the best I could do. So it's very hard. And when your back hurts and your neck hurts, then you feel down. And if you have a bad day, and there's some days you feel like, GV Black, you're the best dentist in history.
Yeah.
And there's some days you feel like the worst dentist in history. And you have to realize there's ups and downs to everything. To put it in perspective, just be happy, you're not a brain surgeon. Imagine the stress that person's going through. What does their bad day entail?
Yeah.
So it's all about perspective, and it's all about realizing you need that time to breathe. And I know people owe, and it's really crazy how much money people owe now. A friend of mine owes quite a bit of money, and he's dating someone that owes quite a bit of money. And I said, you need to rethink this relationship. So
that's my situation right now.
Exactly. So, wow, that's a lot of money you owe. Yeah. So it's really stressful. And then you graduate, you're in debt.
Yeah.
But you have to realize if you burn yourself out, then you're not going to be able to work effectively. You're not any good to your patients.
Yeah.
You need to be fresh.
Mm-hmm. And interesting. So with the burning out thing, obviously everyone has like their own way of coping with it and realizing they're having burnout. And you hear different things like, and sometimes I'm at work, I'm like, am I burnt out? Like I ask myself, I'm like, I don't know how that feels. Like, what is, like, how do you, have you heard from people or yourself? Like, what would you say, like, or some warning signs to be like, let's like take a week off or a day off. Let's just like regroup here.
I think
because you're heading down the wrong,
that's a really good question. And one of the students I had, it was very funny. He said on Sunday, your weekends sort of dictate and tell you how you feel about work. One is you wake up on a Sunday and you realize, thinking it's a Monday, and then you realize it's not a Monday, and you're so relieved.
Yeah.
So that's one little sign.
Yeah.
Another sign is what he called the feeling of impending doom. Yeah. So every Sunday night before school started again on Monday, he said he had the feeling of impending doom.
Yeah.
So if you just struggle to get out of bed in the morning and you're just in practice, so you should be excited to get to the office, do procedures, talk to patients. I think when you also get short with patients, when somebody asks more than 3 questions, I think when somebody, comes in and looks like they haven't brushed in about a month and you just
snap,
lose it. You go off on, how can you not brush rant? Then you're thinking, I think I need a day off.
Yeah.
And there's no harm in taking that time off because you come back refreshed. And you sometimes need to take a step back and realize that if your body's hurting, sometimes it's because your mind is hurting and you're just overwhelmed. And there's no harm in realizing that, again, you're not great at something and maybe you need to get some more education before you move forward. Unfortunately, again, because of financial pressures, or maybe Dunning-Kruger, they think, hey, I watched an implant on YouTube. How hard can it be?
Yeah.
So I have a friend who's a periodontist, and someone sent her a case. It was a young fellow, high smile line, and a new grad put an implant in the anterior the anterior region on a high smile
as
line.
You do.
Yeah, so 9 strikes against him. Yeah. And went to put the crown on, and it was a young cool guy, and he said, dude, this crown, why does it look so high? And sent it to my friend and said, can you just put some gingival on it?
Yeah.
It's not cut and paste.
Yeah.
And then said, what did you think about my placement? And the answer was, it was bad.
Yeah.
I mean, there was one osteoblast struggling to, hug this implant. So but if you don't know any better, you may look and go, oh, that's the best that could have been done.
Yeah.
And it's not the best that could have been done. So recognizing that, if you're struggling in procedures or it's taking you seven appointments to finish a molar endo and you still only find 3 canals, maybe it's time to take a step back and say, I'm not really good at this, and I need to start slow. I always tell younger guys, start doing the cleanings on your patient. Start getting to know your patient. Let them get to know you, and you build a trust. Because I have a former student of mine who is a resident, was interviewing for an associate, and said the same thing. Get to know your patients. Get your feet under you. Yeah. And don't bite off more than you can chew when you start. And he said, do cleanings. Get to know who you're working with. And he put his hand up and said, well, I just like doing big veneer cases. So my friend reacted in words that I will not use for your listeners and said, are you kidding? Yeah. And he said, have you done a veneer? He said, no. So then he says, well, what makes you think someone's going to trust you to do one when you've never done one and the ink is still drying on your diploma? Yeah. So you need to walk before you can run. And one thing I'll tell you quickly is a lot of people now, there's an impatience, whether they owe money or they just want to get going. They don't realize that back in the day, you started at an entry-level position. So I use the example Southwest Airlines, a very huge airline in the States. Yeah. One of the former CEOs, her first job was as the legal secretary to a lawyer who also was a CEO of Southwest Airlines. So this is somebody who started in an entry-level job and one day was running the company. Yeah. And that's how dentistry is. You got to go in, you got to watch, you have to observe, you have to show x-rays to your principal dentist, and if you don't feel you're getting the guidance, then you have to find a mentor. Yeah. And let me tell you, finding a mentor is probably one of the greatest things you can do.
So how would you, because we're based out of Toronto right now. So I found when I was looking for jobs, most of the available positions are like satellite offices. So the principal owns like 3 or 4 offices, and they just plop an associate in and sort of see the patients. So it's hard to find mentorship, I find. So what recommendations would you have for someone who's starting out, if they're working in an office that they're not necessarily working at the same time as other dentists, or even have like direct contact with the principal that often? Like, how would they seek out and find that mentorship?
That's great. Luckily, because of the internet, you can have a mentor on the other side of the world. Yeah. Sometimes people need more than one mentor. You need sort of a life mentor. You may find that the person telling you about dentistry is not the right person to tell you about life because their life's a bit of a mess. You'll find a lot of dentists or doctors or anybody, plumbers, that are really good at their job, but maybe at home is not working out so well. Mm-hmm. So you sometimes need to find a life mentor, but you also need to find a clinical mentor. Sometimes it could be somebody who is 2 years ahead of you in dental school. Yeah. Sometimes, because my ortho study group is made up of, together, the 5 of us, we've been practicing for, 115 years or something. And in total, not just me. And so I find I mentor a lot of people because people like to have some direction, also like to know that, like you said, am I burnt out? What's going on in my life? Yeah. So I think sometimes people just have to seek a mentor like they're dating, and you have to go up to somebody and say, hey, can we grab coffee and talk about you mentoring me? Yeah. And there are people who would love to do it, and there are people that just don't know how to be a good mentor. Yeah. And there are people that aren't good to be mentored in the sense that they don't take criticism well or feedback, as I said. So I think you have to look around, and sometimes it could be a younger instructor maybe, or somebody that has more time, somebody who's transitioning out of their practice, and that could be from your dental school. That could be, you could find a mentor in a lab. Maybe the mentor is going to be a prosthodontist you refer to, or a periodontist you refer to, or somebody who has the experience you feel a connection to, and you think you have similar interests, and it's like dating. You can't be afraid to go up and ask. Or maybe you're at a conference and you can say, wow, you've got some great ideas, do you mind if I ever email you or whatever? And some people love it. I love doing it. I'm helping people all over the place. Yeah. Some people don't. So, and again, you don't marry everybody you date. Yeah. So you're married, so Yeah. So you have to sometimes, then you've got that mentor, then you have to find a life mentor. So maybe there's there's somebody out there who maybe not even in dentistry, maybe they own a dental lab, and they seem to have a reasonable balance. People always say, I want balance in my life. I said, if you want balance, buy a scale, because balance is not going to happen.
Yeah.
So you have to look at people you respect in school. Maybe when you're in first year, somebody in third or fourth year was just really kind to you and showed you the ropes. Stay in touch, because that person's got 3-4 years on you.
Yeah, for sure. I've done that. It's been so valuable, I find, because they're sort of at your level as well, so you're not like maybe shy to like approach them and ask like stupid questions.
Exactly. Yeah. And if you feel when you're talking to someone that you feel you're being judged, that's not the right person.
Yeah.
You have to be comfortable enough to, it's like being with your therapist, to say, I'm really nervous about this, or I'm stressed about that, and I screwed up.
Yeah.
And a lot of times people are just so anxious to get to the finish line, they're forgetting there's a race to be run. And I think that's part of the reason you get burnt out, you get stressed, you don't want to go to work on Monday morning. You see a name on your day sheet, you freak out, going, oh no, this person's coming back, And a lot of the times the stress you're having is because you don't know how to manage patients.
Yeah.
Because you can drill the best crown in the world, you can drill a class 2 better than anybody in your class, but if you don't have the soft skills, you don't know how to explain the procedure, and you don't understand how to sort of, gently get the patient on board with you, then you're going to have a problem. And I always tell people Simon Sinek's amazing. I don't know if you've watched Simon Sinek.
He's great.
He's great. The why.
Yeah.
And a lot of it's kind of a little corny and whatever. And he's great. You might find his book a little long, whatever. But if you don't know why patients come to you and you don't know why they've come to your office, then how are you going to be able to serve their dental needs?
Yeah.
I mean, you've got a CAD/CAM machine, you've got a scanner, you've got a drill, you've got all these, you've got the what.
Yeah.
The how is the procedure, the why is just what procedure do they want.
Yeah. And so that's interesting, because a lot of times, I mean, myself, like going into like healthcare, and that's something I wanted to do like since high school. And I always knew, like, I was always like involved in sports, and like, so you're always around people and you have like that camaraderie with like your teammates and communicating that way. So I knew like the soft skills were there. Like I was like maybe wrongfully, so I was really confident in that side of it. So when I was in school and I was in pre-clinic, and like you said, like everyone around me is Picasso, and I'm like hacking like class 2s and just like milling through teeth, like trying to get it down to like an acceptable level. I knew like I could like fall back on that. So for the opposite end of the spectrum, a lot of times now I talk to like a lot of dental students, and I find, especially in Canada, because it's so hard to get into dental school, that it takes a special kind of person who's really book smart and maybe lacks the soft skills to get in. And I talk to them, and instead of asking me about like life, they're like, oh, how much money do you make? How much money do you want to make? How much money do you want to make when you own a practice? I'm like, man, like just like ask me a proper question. Like, what is, like, it's not all about money. It's not all about like how much like procedures you do. It's about the soft people, the relationships. So if you're in dental school, or if you're a new grad and you don't have those soft skills, what avenues are there, do you think, would you recommend for someone to like seek out maybe improving that skill? Because it's hard to do it necessarily on the job sometimes. So yeah, what recommendations would you have in that
Well, first
regard?
of all, number one, you can't be one speed to everybody. You can't watch a podcast, listen to a podcast, or watch a video, or watch the principal dentist, because that principal dentist has some lines and has a relationship with the patient. You're thinking, oh, I'm going to use that line. And then the patient looks at you like, what did you just say to me?
Yeah.
So you have to develop your own pattern, your own lines, etc. The other thing is, if all you want to do is make money, and that's how you're going to judge how your career trajectory is, you're going to be miserable, and you're going to burn out real quick.
Yeah.
Because at the end of the day, you're going to make a living, you're going to have a roof over your head, food on your table. What do you want your legacy to be? So I want you to look to the end of your career.
Yeah.
And you want people to say, he was the best dentist, or she was the best dentist I ever had. They were always so kind to me. When my dad lost his job, she did all the treatment we needed, and she always found us somebody who would help us out. And I was in pain once, and he came in on the weekend, or this, that, and the other. Mm-hmm. That's your legacy. Yeah. So you have to realize money will come. Okay, but if that's your only focus, then healthcare is not for you. And a lot of people are losing sight of the fact that you're a doctor of dental medicine, or you're a doctor of dental surgery. Like, you're a healthcare practitioner. Yeah. And people are losing sight of that. And dentistry is turning into this commodity: free whitening, free this, free that. Yeah. And it's all about the business. And in orthodontics, I always say to people when I lecture or I'm mentoring them, I say, I don't care how many cases you start. I want to know how many cases you finish. Mm-hmm. And how many cases do you finish? well.
Yeah.
So going back to your question about, how do you develop those soft skills? A lot of people I know have actually gone and done stand up. They've done
Really?
They've gone to Second City.
That's diving in deep. Yeah.
But you know what? You need to, your first day of dentistry without. I always remember my first day before I went to my internship. I practiced a little, and it was as if someone turned a fire hose on in my face. You're just like overwhelmed.
Yeah.
You don't know what you're doing, and so it is difficult when you don't have clinical confidence to have those skills and look a patient in the eye and say, here's what we're going to do, because in your head you're going, I hope this is what you're supposed to be doing. Hopefully there's no there's no patients listening to this, but so I tell people do Second City. There's something called Toastmasters.
Yeah,
and
I've looked into that actually.
Toastmasters
That'd be awesome
is amazing,
to do.
and I have a couple friends that have done it, and it made a huge change in them because you just learn to shake off your fears.
Yeah.
You can read all the self-help books you want, but reading by yourself, in a coffee shop while it's cool is really not going to help you.
Yeah.
Talking to somebody in the coffee shop will actually be, better.
Yeah.
So you have to really get outside of your comfort zone. You have to really push yourself and just be really sort of nervous. And when you get nervous, then that's when you really move forward. Because if you ask any major performer, they'll tell you if you go on stage without being a little nervous, you're not going to give a good performance.
Yeah.
So Toastmasters, Second City, also striking up conversations with strangers, because when someone sits in your chair, that person's a stranger.
Yeah.
And you're going to pick up a needle and pick up a drill and say, hey, nice to meet you.
Yeah.
And, go to town.
Yeah.
So you have to take a step back, that for someone to let you get to that point, you really need to develop that trust. They have to know that you care.
Yeah.
I always laugh when asking a student a question in an interview. They say, well, I would show empathy. Well, you're either empathetic or you're not. You just can't show empathy, on demand. So I think by doing things, again, going out of your comfort zone, talking to strangers in a coffee shop or wherever you are, Toastmasters, Second City, anything that gets you talking, developing the skills, and you may find you've got a sense of humor you didn't even know you had.
Yeah.
And the more comfortable you become with your clinical skills, the soft skills tend to follow, because you develop that confidence. Because if you say to the patient, so, you have a large restoration in this tooth, I joke like it's an MOBD, LMNOP, it's every letter in the alphabet. Yeah. And
it's a good one.
Yeah, I always like that one. I think the best thing is you need a crown.
Yeah.
Who's going to go, I remember one mother who she's one of my favorites. When I first got into ortho practice, I said, well, we could do it this way, we could do it this way, we could take teeth out, we could not take teeth out. And she put her hand up and she goes, I'm not here to hear my opinion, I'm here to hear yours. And it was a wake-up call, because I was almost thinking out loud.
Yeah.
And sometimes we overanalyze and we beat ourselves up, and that's why I tell students, when you first get into practice, but starting in dental school, take your full mouth series home if it's loud, for HIPAA reasons and everything. Take the full mouth series home. Show an upper class person, and like somebody in third or fourth year.
Yeah.
Do a proper treatment plan. Sit in a room and just quietly. And I know dentists to this day, that's how they still do it. They don't treatment plan on the fly. They take the records home.
Yeah.
They have a view box, or they have it on their computer if they're digital, obviously. Yeah. And the view box being
some people are like, what's a view box?
Yeah, I know.
What's a light box?
So there are still people. Trust me.
Yeah.
When you say, can you email me the X-ray, and they're like, we don't have that. So by doing that, and it's like CPR, airway, breathing, circulation. You got to do it in the right order, or it's not going to work.
Yeah.
And the more you can talk to people, the more you realize you're not alone. Everybody stresses. Everybody has bad days.
Yeah.
The more that you can know that, I have a day off or a half a day coming up in 6 weeks. This is great. I'm going to hang out with my friends, or, go out with my wife, husband, whatever.
Yeah.
That's amazing. And then you look forward, you're counting down the days, and you're going, mental health day.
Yeah.
And
look forward to it.
You look forward to it.
Yeah.
And exercise, again, the yoga thing, anything you can do for your back. And it's funny because guys your age, a lot of them are, I still do this. I'm still doing Olympic lifting.
Yeah.
I say, you're a dentist, right? And they say, yeah. I'm like, yeah, I wouldn't do that. Because I always say you open and close a door enough times, the hinge is going to go at some point.
Yeah.
And that's like the joints in your body. And dentistry is hard on your body and hard on your mind.
Yeah.
I mean, everybody I know has had an ulcer, so you have to learn how to take yourself out of the stress and separate yourself from the stress and not feel guilty to take a day off.
Yeah.
Because if you don't take a day off and you're angry every time you walk into the office, what do you think happens? I don't know if when you're in your offices, if maybe an office manager or the dentist comes in is in a bad mood, what do you think happens?
Yeah, it affects the whole team.
Everybody's in a bad mood.
Yeah.
And then the patient goes into the next room and the patient says, "Hey doc, like what's wrong? You seem in a bad mood. Maybe today's not a good day. I'll come back.
Let's not drill my teeth.
Yeah, let's not drill my teeth today. I'm good. I'm good.
Awesome.
I'm in pain, but let's move on."
Yeah.
So again, walking before you can run. Finding mentors. And when you're in dental school, you may have different mentors. Your mentors may be an instructor. Your mentors may be someone in 3rd or 4th year.
Yeah.
Or 5th year, depending where you're going to school.
Mm-hmm.
But I coach people who are applying to medicine, dentistry, law, film school, anything. So I help them learn how to be interviewed, and I give them readings. And so a lot of it's about psychology and about themselves. Yeah. And these are people that I still speak to after dental school, after their specialties, entering into practice.
Yeah.
And you have to know yourself. And sometimes don't get upset when you're entering into practice if you realize the practice is not for you.
Yeah.
When I graduated ortho, again, I couldn't even put my diploma in a frame yet because the ink was still drying. Somebody called me. They were supposed to look after an office, and she couldn't go in that day for health reasons. And she said, "Can you look after it?" I said, "Oh, okay. I want to help you out."
Yeah.
It was this massive office, tons of hygienists, patients everywhere. I didn't know what I was doing.
Yeah.
And I realized I was in a shirt and a tie, and within 45 minutes, the back of my shirt was soaking wet, and thinking, this is bad. And I still remember this businesswoman came in, and she was in a hurry, and she said, "My bite doesn't feel right. You need to adjust my bite." And I still remember looking at her going, "Ma'am, I just met you. I don't think that's a good idea because, we'll all be eating Japanese food off the floor because the table legs are going to keep shortening each one, and I'll be left with nothing."
Yeah.
So I realized within an hour, I can't practice that way.
Yeah.
That's not for me. My office is 600. I was originally in 600 square feet, and when I had to move my office, people thought, "Oh, what are you going to do? Are you going to expand?" I said, "Yeah, I'm moving to 692 square feet."
Yeah.
In our office, there's 3 of us orthodontists. We do all the work ourselves. We don't have. We put on every bracket, every wire. Again, things have changed.
Yeah.
We scan for all the appliances. Bracketing is done through a scan and then 3D virtual positioning, and then you get the guide, and on the braces go. So it's so different now.
Yeah.
All surgery is done through virtual surgical planning.
Yeah.
The surgeon's in one part of the city, I'm in another with the other orthodontist, and there's a engineer in Colorado.
Yeah.
And that's how we do it
pretty
now.
cool.
And it's amazing.
Yeah, it's changing a lot. The whole technology side of things is incredible.
And that helps you find a mentor. I have people that I'm mentoring in other parts of the country, and I say, "Hey, scan the case, let my lab print the models, and I'll take a look."
That's awesome.
So you get a chance to, you can communicate with anybody anywhere.
Mm-hmm.
And the thing students have to realize when they're in dental school and when they're getting out of dental school, and I think there's amazing opportunities. There's a great site, Dental Student Thread, on Instagram, and you see people being very honest, talking about the stresses, and I never thought I'd get into dental school. I never thought I'd get out of dental school. You're so excited to get in, and the next thing is, am I going to get out of here?
Yeah.
And so you have great resources where you can meet people and talk and realize, again, you're not alone, but you need to have the end in sight from the beginning to decide what is it you want out of practice, and why are you, and again, going all Simon Sinek, why are you doing this?
Yeah.
Why'd you become a dentist?
Yeah.
You had an answer ready for your interview, but did you really mean it?
Yeah.
So I think
awesome.
I think that's really important.
That's pretty cool. So in terms of, like you said, you do a lot of coaching and everything like that. So I want to see sort of how you get into that with, obviously me doing this podcast is a bit of a side hustle for me, and something that I'm trying to do outside of dentistry just to, change it up and hopefully just see where it grows to. So my goal for this, just to give you a little bit of background on it, is I had the idea of the podcast because obviously I'm a big podcast listener myself during dental school, and I got a lot of value from other people and learned a lot from what they're saying and teaching. So during dental school, like my whole thing was like, I'm going to be like going to the business dentistry. I'm going to open like practices, and so I'm like listening to all these like dentalpreneur podcasts and Howard Franz podcast. And now I'm out of school, and just because of like life situation and like my wife being where she is, obviously opening a practice is not something that's like immediately in my immediate future. So I thought of starting this Newbie Dentist to build sort of something and build a bit of a brand. And what I wanted to get into it because what I'm passionate about is talking to dental students and coaching them and guiding them into like finding a good associate position and sort of not getting burned like I got burned when I started my career and like wasting a few months and with some bad situations. So you mentioned do coaching, and that's something that's exciting for me because that's something that I want to get into down the line as well. So talk to me about what you're doing outside of dentistry. Like, what's the side hustle that you have going on right now? And we'll sort of dive into that for a little bit.
It's interesting because just like you need a mental health day, you need a side hustle or a couple side hustles.
Yeah.
And one of my favorite instructors in dental school who recently retired took me out to lunch. It was I still call him doctor. I can't call him by his first name.
Yeah.
And he said, if you think you're going to go into dentistry and accumulate all this wealth and everything, he said it's very hard to do good dentistry and be a good businessman because nobody graduates dental school. They get a DMD or a DDS. They're not getting an MBA or a BCom.
Yeah.
So you're being asked to run what could be, at the end, a 7-figure business, and you have no experience. You end up with the wrong accountant, the wrong lawyer, whatever. So you have to learn how to educate yourself. And again, like I said, who are you as a person and a dentist? So if you want to coach students and say, hey, you thought, I'm going to open up 5 practices. Now you see what it's like to run 1 practice, and you're thinking, I don't know, being an associate's not so bad. The compressor broke. See you next Tuesday.
There's a leak. So.
Yeah, there's a leak. Got to run. By the way, your receptionist is quitting. I just heard her in the break room. So, and I don't care.
Yeah.
So there's that. There's sort of not my monkey, not my circus. It's like, oh, I don't care. It's not my problem. So developing a side hustle is good because you need to expand your brain and you need to get out of the dental world. A lot of people like to teach, even if they're teaching in dentistry, it's a nice chance to, chat with colleagues, whatever, get out of the office.
Yeah.
Everybody's got a passion, whether they love yoga, become a yoga instructor. Mm-hmm. Doesn't, it may take you a little extra longer, do it. Maybe you like to cook, maybe you like to paint. Who cares if you're good?
Yeah.
Burn some bread and, again, not everybody's Picasso.
Yeah.
So it's important to realize that you have a passion. Do it. If it means taking an art class or it means taking a language class. I decided 4 years ago I'm going to learn Italian. So I've been studying Italian.
Yeah,
and
that's awesome.
I also ended up in the coaching because a dentist who I know called me and said his daughter was applying to dental school. Could you talk to her about her interview? And I said, I don't know what to say. And so she came in and they sat together. And the first thing I said to her was, I said, you need to sit up properly. Mm-hmm. And then I thought, hey, you know what? I think I could do this. I like giving orders. I think it's good. And, over 200 plus people later,
that's awesome.
It's kind of crazy.
So how did that grow? Like from the first person, like how did you implement that? Or was it something that naturally came?
I hate to use a corny term, but it was organic. Meaning I would help, kids of friends, and then all of a sudden strangers would call me.
Yeah.
And then it became like a thing.
Yeah.
So I edit for them, and there's even something called the 5-minute journal, which I think a lot of people know. It's an amazing, actually, I would tell students, you need to do the 5-minute journal because it asks you what you're grateful for, what would make today great, but at the end of the day, why did today suck, essentially?
Yeah.
And what would have made today not suck?
Yeah.
And it's good because there is something to be grateful for every day, as corny as, again, that sounds, because you're in dental school, you're going to get out of dental school. I always tell people when they're in school, every day is one day less.
Yeah.
So every day means you're one step closer to the finish line, not to the beginning.
Yeah.
And if you think that way, when we were in 4th year dental school, somebody put up a thing where you just tear down the numbers, 300, 200, whatever.
Yeah.
So developing a side hustle, everybody's got a passion. And if you don't have a passion or you don't have a hobby, then try a bunch of different things on your mental health day or whatever it is. I mean, look, you dove into doing a podcast and you're now heard in almost every continent. And that's amazing.
It's pretty cool.
Yeah, it's amazing the reach you have. And there's somebody on the opposite side of the world who said, you know what? It's not just me. I'm not the only one stressed, because everybody thinks they're the only one stressed, the only one suffering, the only one, crying at night because something happened. I still remember a classmate of mine who we called the restorative queen. She had golden hands, and she had this patient who was just so hard on her, and she was the nicest person on earth. And she finally got these impressions for her removable dentures, and she had her articulator in the box it came in. Standing at the top of the stairs, and I was there when it happened. The handle broke away.
Oh, man.
And it wasn't those sturdy articulator boxes. It was the cardboard box. Boom, 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 and crash.
Yeah.
And she lost it. And I don't blame her. I mean, how many people do you see in a lab polishing a temporary, not realizing there's no net at the back, and all of a sudden you hear clackety clack, boom, the temp's gone up the vacuum hose.
Yeah.
So stuff like that happens, and that's why you need to have something on the side, whether you do a podcast, whether you bake bread. I mean, I've got friends doing all sorts of crazy, inventive, cool things. They're ski instructors, they're swim instructors, they do synchro swimming with a team, or they're cyclists. There's a million things you can do, but you have to push yourself to do it.
Yeah.
It's just like working out. You have to treat working out like a job, otherwise you're not going to do it. Yeah. So I think it's important to have a side hustle. So the consulting or coaching for me people just kept coming, and there's a lot of imposter syndrome, and that never goes away. And I thought, what am I actually telling these people that's of any value?
Yeah.
But then I figure, if I help somebody and they said, you helped me so much, and then they sent somebody, I guess I am helping somebody. Yeah. But it's like being a dentist at this point in your life. I'm sure you go into work some days and you're thinking, whoa, some of your listeners are still living at home, and they're, on Monday they have a scalpel in their hand or a syringe, and then on the weekend their parents are saying, hey, did you take the garbage out? They're still a kid. And then on Monday they're a dentist.
Yeah.
So it's important to realize that it's not the be-all and end-all, and that you have to put it in perspective. You have to continually educate yourself. You have to always want to get better every day. But taking that time away from dentistry is just as important, because otherwise, like you said, you burn out.
Yeah. So with the side hustle side of things, just like for my own benefit and for the listeners' benefit, at what point, like when you started it, did it go from like, maybe this is like a hobby, I'm just doing this for fun, or like, oh wait, I can like monetize this, or this can be like a nice little, not even like necessarily that the money is like you rely on the money, because obviously like if you're in your day job, you're making pretty decent money as a dentist, but for the validation of like this hobby is now like a thing, like people are paying me for my services.
Right. There are some people that don't want to monetize, or some people that they're into bodybuilding, and I say, oh, are you doing competitions? They say no, because if I do a competition, it's going to feel like work.
Oh, okay.
So you have
That's
to know.
A good point.
Yeah, you have to know who you are, or say, wow, you should open a restaurant. No, it's too stressful. I don't want to do that. That would ruin my joy of doing whatever it is I'm doing. So you have to know who you are. It's not always about monetizing it. If you feel, hey, I don't always want to practice dentistry 5 days a week. I know people that book bands. They practice 2 days a week, and they book musicians. Yeah. And I know people that that actually have great, they're amazing artists, and they sell their art, or they tutor or coach other languages or sports or whatever, and they actually have a real business. And some of these people had this business even before dental school, and they've continued it. So if you do want to monetize it, you have to make that decision. You need to be a good dentist before you can start having a second business. Like, you need to be good at your first business. Yeah. So it's important to cultivate that the same way you're cultivating your dental skills, and also realize sometimes when you monetize something, you take the thrill and the fun out of it. Yeah. So you have to decide, is it all about money? And when you graduate dental school, I know one guy, he graduated dental school, he's a specialist, and this was 100 years ago. He ran out and got a Porsche. Yeah. And there was a point where he joked he was almost living in that Porsche, because he couldn't afford it. And he was over 6'2", so living in a Porsche was actually not going to be that comfortable. Yeah. So you have to decide right now, you don't make any money on your podcast, and you're hanging out with me on a Saturday where you could be doing a million other things, but at some point, maybe it'll monetize itself. Maybe you'll approach somebody and say, hey, do you want to sponsor this so that I can have a bigger reach and reach more people? Yeah. But at the end of the day, I could say to you, this year you made $10,000 doing your podcast. Or, and I could also say to you, there's 300 people in some other part of the world that's 10,000 kilometers away that are addicted to your podcast because they listen to it and feel so much better about the stresses of dental school that when they go to school on Monday, they've laughed off the stress on the weekend.
Yeah.
That's
so valuable, yeah.
Exactly,
That's
but you have to say to yourself, there's money, but there's impact.
That's pretty cool. And that's like, it's funny that you mentioned like the, be good at your day job first. Cause I think that's like just my personality type. Like my wife gets on me all the time. She's like, don't forget like you're a dentist to like be a good dentist first and then like start all these like business ideas. Whereas my mind is always like going like 100 miles per hour. Like, oh, I'm going to do this. I'm going to start this. I'm going to start this. Yeah. And it
sounds like you married up, that your wife's smart.
Yeah, so. No, she's I don't think she listens to this, but if she does that,
well, she will now.
I'll give you some brownie points for sure. So I don't know, like I have this like big vision, and it's partially because maybe say you get some like life mentors and life coaches. I listen to like, I don't know if you know of like Tim Ferriss.
Oh, of course.
Yeah, some like
4
big
Hour Body, 4 Hour Work Week. Yeah.
So I'm a massive fan of his podcast, and he always has like influential people, and one of the things that really sticks with me is like the whole thing of like legacy, and you mentioned legacy earlier, of like what do you want to be remembered for. So I'm starting all these like little projects here and there, not knowing like which one might take off, and when I'm like 80 or when I'm like dying, I can look back and be like, I'm so happy I did it, because now it's this, and now like not even for the like the fame or the money, like
it's going to continue beyond
me. So I have like the humbleness to be like, my dentistry is going to retire when I retire. Like I'm not going to be like JV Black and like the Azami classification of something. And like that's not necessarily, but that's not necessarily like my like driving. Yeah. So I want to create something that like, to be like, this is like someone did this and this is like a thing, and it's like changing people or helping people. So that's where I'm at right now, and that's what I'm trying to like pursue in the future. So we'll see where it goes.
One thing you have to recognize is Malcolm Gladwell in his book talks about 10,000 hours.
Yeah,
a lot of people don't even realize where that comes from. It comes from, to master skills, 10,000 hours. Let's say you're a dentist doing a little bit of Invisalign every week because you think, oh, there's this technician in Costa Rica and they just teach me how to do orthodontics. Or you're putting implants in 6 months after, and then you realize you get in trouble.
Yeah.
Okay? Just because you see it on Facebook or see it on Instagram or watch a YouTube video doesn't make you an expert. Mm-hmm. I mean, there's that great guy in Russia who's on Instagram who took out his own wisdom tooth.
Yeah,
Dr. Yaka something. I can't remember his name. I've actually chatted with him on Instagram.
Really?
Yeah, he's pretty funny.
Yeah.
But 10,000 hours. So let's say you do a little ortho 4 hours a week.
Yeah.
You would have to work every week of every year for guess how many years to get your 10,000 hours?
Like 20, 30 years?
52 years.
52 years.
That's a long time
to
become good. So it takes 50, so you're not really good until for 52 years. Whereas you realize, your wife's about to enter her medical residency. You get that 10,000 hours in, right away.
Yeah.
Because that's all you're doing.
Yeah.
So one way to also avoid stress is focus on what you're good at, and if you're not, learn how to be good at it. Mm-hmm. But also, if you're going to do ortho or endo or whatever, show your work to a specialist. And if a specialist looks, because you, again, Dunning-Kruger, you may look and think, hey, this looks great, a lot of people that I spoke to of my generation used to do all their own endos until they realized they never found 4, let alone 5 canals, and they were drilling holes in all their crown and bridge and realized, I think I need to stop doing endo. Because let's say you're an associate.
Yeah.
And let's say you're doing a procedure that's $2,000. You're getting 40% of that $2,000. Take off the lab, take off your percentage, take off the taxes. You're going to compromise a patient's health and well-being, and which is number one, not number two. That's number one, and your career for what in the end comes out to $300 or something like that.
Yeah.
So doing an endo that takes 5 appointments or something, you have to know. And I know endodontists that they'll get a referral. There's part of an instrument in one canal and another. So you think people would after they've separated an instrument in one canal, instead of saying, "Oh, geez, I'm in over my head." Well, I'll go to another canal. Let's see how many I can actually finish before I set this off. So you have to realize you're not doing the patient a service, and guess what? That patient's what I call a geographic failure. They left. How many times do you get an emergency patient and they came in and you did almost nothing for them. Maybe they had a seed stuck or something, and you saw them and you said, oh, this is so simple. Do you know how many people, when they walk out with that patient would get a bill for a specific exam, a merge exam, a periapical, you flicked out a poppy seed and the patient got a bill for $250.
Yeah.
Do you think that patient's coming back? Do you think that patient's going to refer you patients? No, but you're like, hey, I made $250 in 10 minutes.
Yeah.
No, you didn't.
Yeah.
You were unprofessional and you just ruined your reputation.
Yeah.
For a few dollars.
Yeah.
And you have to have the big, I'm not saying you necessarily have to have a vision board, but you have to have the big picture.
Yeah.
And this is a problem. Everybody looks on Instagram and sees all these dentists or whatever, and they all look like they have amazing practices. Well, if you're on Instagram that much during the day, I don't know how busy. You can't be that busy, number one. And number two, I know some people that are really funny on Instagram, and I actually see what they do clinically, and I write them a note saying, you might want to take another look. You did this, you did that. And these people have written back to me and said, thank you so much. I didn't realize. I think I need to take a step back. Mm-hmm. And life is not about Facebook. And I really think a lot of people need to take a step back from social media, because even though you think it doesn't bother you, it bothers you.
Yeah.
One student who I coached, he's in his last year of dental school, he said he was in Europe with some buddies and they were having the worst day. It was pouring rain and they hadn't eaten, and it's just the whole day was ruined.
Yeah.
And they ended up in this restaurant. So one of them took a selfie and everybody's writing to them and saying, wow, you look like you're having the best time. And he's like, no, I'm having the worst day ever. And he goes, I'm hungry. We have no money. Like, this is our last day.
Yeah.
I'm not happy.
Yeah.
But everybody else thinks, wow.
Yeah.
Look,
it's easy to fake it. It's easy to fake reality.
Well, everybody's faking it till they make it.
Yeah.
And there's a lot of dentists out there that are, I hate to say it, they're crappy dentists, but they have soft skills to the nth degree.
Yeah.
And people think they're charming and great, but they don't have the hard skills. So if you look at that 10,000 hours and you look at how hard it is to become good at something, when you become good at something and you get that under your feet, then, it's good that you've got a lot of little side hustles and you're thinking, which is going to be my main side hustle?
Yeah.
I mean, I like I said, I do some editing work for the 5-Minute Journal. And because why? I started using the 5-Minute Journal. I thought, this is great. And I wanted to do some speaking. How did I do it? I approached the people who do the organizing.
Yeah.
What's the worst thing you're going to hear?
Yeah.
No.
Yeah.
And you know what? To move forward in life, you're going to hear a lot of no's. You're not going to get every job that you apply for. Not every patient's going to accept your treatment plan. But the other thing is, if people aren't accepting your treatment plans and your practice isn't growing, whose fault is it?
Yeah.
And the person responsible is the person you see in the mirror every morning. Mm-hmm. And that's you. You can't keep just blaming everybody else. I'm sure there's one or two people that are friends of yours, and they say, "Oh, you went to school in Australia." And oh yeah, all the restaurants in Australia are terrible, and all the service is terrible. This is terrible, that's terrible. I always look at that person and say, well, maybe it's not the restaurants. Maybe let's look at the common denominator.
Yeah.
Let's look at you. And why do you find fault with everything?
Yeah.
So you have to own your own crap, essentially, and realize, as a very wise woman told me, everybody's driving a garbage truck. You can let them dump their garbage on your doorstep or not. So you can't internalize. Everybody has a bad day.
Yeah.
So if a patient's upset with you, you got to realize, you got to put it into perspective. It may be something you did, and you have to think about that. Mm-hmm. But you also have to think, maybe they're having a bad day.
Yeah.
But what's wrong with following up at the end of the day and saying, hey, you seem very stressed today, The other thing she said is, let's say you're driving, you're trying to make a left turn, the person behind you is honking the horn, and you're like, what am I going to do? You start getting all upset.
Flustered, yeah.
Yeah, and someone in the car with you says, why are you upset? This person's upsetting me. No, they're not. You're letting yourself be upset. So you have to put things in perspective and realize every day is not going to be amazing. Every day is not going to be Instagram worthy. Every day is not going to be Facebook post worthy.
Yeah.
And that's reality. Mm-hmm. And right now, a lot of people, especially your generation that grew up in social media, it's an altered reality. It's the Matrix.
Yeah, no, it is, and it's interesting because when I first started the page, like I started Instagram before the podcast just to build a little
Test
community,
the waters,
and also to like network a bit to get guests for the show. So I started posting like my work, and obviously like my work's not great. I'm just a new dentist, and posting failures, posting like bad isolation with rubber dam, and not being scared to post it because most people don't post it unless it looks like spotless.
Right.
And it was really satisfying because like about a month in, I got my first, some dental student from the Netherlands messaged me. And she's like, it's really cool that you put your failures because like no one else does it. So I think I was like pretty cool, and that's made me like continue to do that now. And this way, like I can see growth like in my work as well, right? Like if I'm just posting the good stuff and hiding like all the bad endos, or like if I obturate and it's like 3 mils short, I'm not gonna learn, and no one else is gonna learn either. So that's pretty cool that we went through that. So the final thing I want to sort of end off on, and it's something that kind of goes back to like Tim Ferriss, because I'm really sort of inspired by how he does his interviews, is he talks about like sort of like morning routines and like that kind of stuff. So what's your like morning routine like in terms? I know you said you have like you do like the 5-minute journal and like yoga and all that. Something I've been recently trying to get into with like the Headspace app is like meditation.
It's my favorite app.
Yeah, because I like literally everyone that he interviews that's like successful and whatever they do in their work, everyone's like, yeah, I meditate every morning. I do like religiously and have like a morning routine. And then there's that book like the Miracle Morning.
Yes.
So it talks about like waking up earlier and like doing like a gratitude journal and like practicing something or being creative.
I've met the author.
Oh, no way.
I've met a lot of these people. And
That's awesome.
And it's interesting. You have to realize, number one, what they're writing works for them, and also what they're writing is for commercial success. So you have to, and even Tim Ferriss, you got to give him props, because he says, don't just read my book cover to cover and try and do everything, because you're going to end up doing nothing. Yeah. And cherry pick, scan, read the content. And he uses supplements. Maybe you don't want to use supplements. Yeah. Maybe you don't want to eat the way he eats or exercise the way he eats, or exercise the way he exercises. If you try to do 10 things at once and change 10 things in your life, you're going to end up changing nothing. Yeah. So, I've changed my routine, learning how to de-stress every morning. I take, because I read all these people too. And I'm friends with Alex and Mimi Icon, who always talk about on Instagram and YouTube about their morning rituals and everything. And some people look at it and say, oh, like who has the time for that? Yeah. But they may do one thing. Yeah. Fresh ginger, boil some fresh ginger and lemon and warm water in the morning. Get your digestion going, which is a big thing for people. Yeah. And then I'll have my own espresso. Yeah, I may add a little organic grass-fed butter just so I can think I'm cool. And then I always make sure that I pack a lunch. I pack my snacks. I'm prepared, because when you get hungry or hangry during the day, that can throw your day off. So it's always good to eat a healthy diet, get in the habit of doing that. Just like you look forward to your days off, look forward to your cheat days. And I think about my cheat day every minute of every day.
What day is your cheat day?
It depends. I look at my schedule and I'm like, am I going out for dinner? Where am I going? Do I want to cheat day at that restaurant, or do I want to cheat day? I'll wait till Sunday or something. So pasta, bread, butter. I mean, warm bread and butter, that's all I need.
That's life.
And French fries. What more do you need? Some people like cake, some people like French fries. So I have that ritual. I do a little intermittent fasting because it gets your energy going.
I'm going to start getting into that. Yeah.
It works, but you have to realize, like anything, if you always fast 12 hours a day, then your body's going to get used to it. So you got to challenge your body like you challenge your mind. Yeah. And you've got to mix it up. And when you're in dental school, start to see what works. Start to see what gives you more energy in the morning or not. So all about digestion, reducing stress, reducing inflammation. I listen to Headspace at night because I find I'm too stressed in the morning to listen to Andy, tell me I want to relax. Yeah. All those guys have British accents. Do you ever know?
It's calming, I think.
Yeah, but I wonder if they actually have British accents. I mean,
voice actors.
Every meditation app, there's some British guy. Yeah. So I always meditate at the end of the day. I try to read. I always tell people, and I'm a bad offender of that, but I have twilight mode on my phone, just get flux on my laptop, wind down, get the blue light out of you. Yeah. But I'm learning better to actually turn my phone off an hour or two before bed, although I'm kind of addicted to online Scrabble. But but that's important to do, and turning your phone off. A friend of mine, I was just out to dinner with him and his wife has a thing where it's in the kitchen, they put their phone in and it's on a timer and you can't get your phone out.
It's like locks in?
Yeah, it's a lockbox.
Nice.
Which is kind of smart. And that way that's their time to talk, make dinner, do whatever. But you have to know what decreases your stress, because sometimes doing everything, peeling a hard-boiled egg, just like Tim Ferriss, or you're at a restaurant, you're doing piston squats and like wall push-ups to reduce the effect of the dessert you just ate. Yeah. That's not for everybody. Yeah. And you can see, I've read the book. Yeah. So not all that's possible. So you got to pick and choose what's right for you. Change one thing a week. Yeah. Change 2 things the next week. But people don't realize when you're in school, you've worked so hard to get to get into university. Then you work hard to get into dental school. Then you work hard to get out of dental school. But during that entire time, what was one thing that was consistent? It was regimented.
Yeah.
And all of a sudden you graduate. And I remember the first day I was finished with school, and it was at 10 o'clock in the morning, and I wasn't working until the afternoon. I was walking around, and people were going to the dry cleaner, and they're like doing stuff. And I'm thinking, well, where have I been?
Yeah. It's a wild time. Like, you just enter the world. You're like, well, I can like do anything I want right now. Like, there's no one's like,
I know, and you don't know what to do with yourself.
Yeah.
So you have to develop routines because you kind of still need that structure because that's who you are.
Yeah.
You're that person. That's why you went into dentistry. You know what I mean? If you see, a picture in somebody's house and it's crooked, what's your natural tendency? It's like, I'll just fix that for you. So you, number one, never change too many things at once. And number two, find the things that work so that your body's working well, so that your mind can work well, so that when you go to the office, you're feeling good. You're not feeling tired. You're not going out till 11 o'clock at night when you have to be at work at 8 in the morning. Yeah. You're not drinking coffee at 9 o'clock at night. You're not exercising. You're eating badly because you can get away with that stuff.
It adds up quickly.
Well, how old are you now?
Turning 29 soon.
29. I'm sure you say things like, "Oh yeah, I can't go out as late as I used to." You're 29.
Yeah.
But it catches up with you.
Yeah.
And dentistry is hard on your body, and not only that, you may have an afternoon you did nothing but recalls and a couple restorations. You're exhausted. Why? Because mentally you're tired because you were talking to 500 people.
Yeah.
You had to answer a million emails. You had to do some comfort calls, which we'll talk about later on. And when you do a comfort call, it's you that does the comfort call, not a staff member. I'm big on that. But you, again, if your mind is not clear, your body's not humming along, then dentistry is going to beat you down. And then you know what's going to happen? Everybody goes through the angry, frustrated part of their dental career.
Yeah.
You have to be prepared for that and figure out why you're frustrated or whatever, because maybe you're practicing in a way you don't like to. Maybe you're working for someone you don't like to. Maybe you're doing procedures you just realize, after so many years, you're really bad at.
Yeah.
So you have to always check in on yourself. And that's why any journal, like the 5-minute journal or whatever, is really good because it causes you to always self-evaluate because you're doing a great thing. You're posting, and that's what I love because so many people only post the great things. When I lecture, I say, here's a case I don't think worked out so well, and here's why. And I don't blame the patient. Sometimes it is cooperation. Sometimes it is biology. Sometimes, you tried to do your best and it didn't work, or it's a combination of all three.
Yeah.
But you have to always keep analyzing yourself. When I do any procedure, we had some instructors that were really strict, and they're always in my head, and I always think they're looking over my shoulder. And if you work that way, you'll always get better. And recognize that taking time away from the office is not a sin. You need that. Developing a side hustle, no matter what it is, so that you can think about something other than dentistry for a few hours. And recognizing the way to decrease your stress and have the most success is to try and get better, and better at the things you're good at. Stop doing things that you're not good at.
Not worth it.
And it's like doing specialty work you're not good at. That's how people get in trouble.
Yeah.
And how many of your new grads that you're friends with, how many track what happens to their new patients?
Not many, I would say.
What's your retention rate?
Yeah.
And if it's not good, why is it? Because a lot of people come in for free whitening. That's not a loyal patient. They don't care what you have to say. They just want the free whitening.
Yeah.
There's no why there. Simon Sinek would cringe. There's no why. I'll tell you why they're there. They want the free whitening.
Yeah.
But
bargain hunters.
Yeah, that's not someone who says when you move, they're gonna go, I don't care where you move to, I'm gonna follow you.
Yeah.
And I have colleagues and friends that patients come from Europe. When they move to Europe, when they come visit Canada, they book an appointment.
Yeah, that's incredible.
So, and that's the type of dentist you want to be. And guess what? They're successful. Why? Because they built the one thing that dentistry is really about, and that's relationships.
Yeah, for sure. And that's one of the best things I heard in dental school was build the relationships and like the money will come. Like that was like one of the mentors like we had always said that, and it's so true. Like you're not trying to like I think. And I struggle with this too because we focus on what was our production today, what was our collections today, and like we live like day to day. You're like happy one day, you're like sad.
But why
don't
you focus on how many people did I make happy?
Exactly,
today?
I think that's a better way. And I think when I started I had that shift maybe like 6 months ago, I was like, I'm not gonna like because I would come home, I would like chart like my production in Excel and be like, okay, this is how much I made, and like I was like so like focused on that side of it. And now like for the past like 6 months, I don't even like keep track really. Like it might be bad because I might be underpaid, but I'm like I get my pay, I'm like okay, sweet, like that's good enough. Like I'm happy with how it is, and I'm more focused on the procedures and like trying to do better work and build better relationships. And I think in the long term that pays off like
100%. Happy patients send other happy patients.
Yeah, for sure.
I mean, you have to realize you could be 10 minutes late. You don't apologize, which you should be doing. They're on Yelp.
Yeah.
And they're yelping, you know, and not in a good way.
Yeah.
And you have to focus on saying at the end of the day, you did a bunch of procedures. You got paid. You made money.
Yeah.
But you have to look and say, did people leave happy today? That should be your first question.
Yeah.
Did you do them a service, or did you, as a one friend of mine says, did you do them a disservice today?
Yeah.
You know, and if that's the answer, then you got a big problem. And instead of tracking your numbers down to the penny, you should track how many of your new patients book their treatments with you. Yeah. And if not, you need to take a step back. You know, did you comfort call your patients? I have a friend of mine, she practices outside the city. She just got in the habit, everybody she gave local to, she called.
That's
and
great.
People think that, are you crazy? But it's not like she's calling 20 people at the end of the day necessarily.
Yeah.
But she drives, you know, a couple hours in the car. She has her call list. Every time she's at a light or whatever, she'll dial. Nobody answers their phone anyways usually, so you're leaving a voicemail. But it also cuts off emergencies.
It means so much.
It cuts off emergencies because at the end of the day, if you're upset in a restaurant or a store, all you want is to be heard.
Yeah.
And patients just want to know that, yeah, you actually do care about their well-being. And that means calling after hours. Some people, younger dentists, are like, peace out, 5 o'clock.
Yeah. So one of my like mentors was like Howard Friend, and he did this thing. So he did like the 30-day dental MBA, but then he did another like VHS set like back in the day.
1905, yeah.
And it was the virtues of profitable dentistry. And that was one of the biggest takeaways I had from that was he said like call every patient, make sure you get into the habit of that. And like I admit I don't do it every day, but when I do, like it's so rewarding as well. Like people are like, wow, like you actually like called and you like followed up. Like I think that's like one of the greatest things because at the end of the day, like we're healthcare workers, like you said, and getting that satisfaction from it is like worth more than any money.
And not only that, it helps also deal with emergencies. Don't forget to take your Tylenol. Don't forget this may happen. That's perfectly normal. It might be a little sensitive. Call me, etc., etc.
Yeah.
And it's about communication. Because if you're not communicating with your patients and your patients don't feel you're listening to them, you will never be a success.
Yeah.
So track the success of your procedures, track the success of the happiness of your patients when they leave the office, and the money will come.
Yeah,
you will, like I said, I you know, how many there's not too many dentists without a roof over their head or food on the table.
Yeah.
And if they don't have either of those things, I'll show you someone that doesn't care about their patients and never cared about getting better.
Yeah, that's excellent. Perfect. Thank you so much. That was a great episode and a lot of good information there. I'm sure it'll be one of the popular ones and a lot of people will get a lot of good value from it. And so we'll follow up at some point and we'll do the part 2. Excellent. And we'll get more clinical.
I look forward to it.
We'll get it nerd out a bit.
All right. Thanks so much.
Awesome. Thank you, Dr. Freeman.